Bone Metabolism. Published by WordPress.com. Calcium. Forms and functions. Forms. Ionized, less than 1%, active form. Salt, greater than 99%, structural component, bone, teeth. Functions. Blood clotting, neuromuscular transmission, muscle contractility and cardiac function. Second intracellular messenger. Tissue structure, bone, teeth. Storage in bones. Distribution. Plasma, 8.5 to 10.5 milligrams per deciliter. Ionized, 47%, active. Complexed, 6%, inactive, bound to phosphate, citrate. Protein bound, 47%, inactive, bound to albumin. Bone, 99%, mostly as hydroxyapatite. Dietary needs. Kids, 600 milligrams per day. Adolescents, 1,300 milligrams per day. Adults, 750 milligrams per day. Pregnancy, 1,500 milligrams per day. Breastfeeding, 2,000 milligrams per day. Fractures, 1,500 milligrams per day. Absorption and balance. Site, duodenum and proximal jejunum, facilitated diffusion, so in duodenum ulcer cause defect in calcium absorption. Kidney, 98% reabsorbed in proximal tubules, so in CKD supplement calcium. Balance, positive during the first 3 decades of life, negative thereafter. Foods rich in calcium include 1. Dairy products, milk, cheese, and yogurt. 2. Leafy greens, kale, spinach, and collard greens. 3. Fish, sardines and salmon, with bones. 4. Fortified foods, calcium-fortified cereals, orange juice, and plant-based milks. 5. Nuts and seeds, almonds and sesame seeds. And 6. Legumes, beans and lentils. These foods can help meet daily calcium requirements for strong bones and teeth. Phosphorus. Forms and functions. Distribution, 85% in bone. Plasma, 2.5 to 4.5 milligrams per deciliter, mainly unbound. Functions. Enzyme metabolism and buffering. Structural component, ATP, CAMP, phospholipids. Dietary needs. 1,000 to 1,500 milligrams per day. Absorption. Site. Distal jejunum, simple diffusion. Foods rich in phosphorus include 1. Meat and poultry, chicken, turkey, beef. 2. Seafood, salmon, tuna, and shellfish. 3. Dairy products, milk, cheese, and yogurt. 4. Nuts and seeds, sunflower seeds, almonds, and peanuts. 5. Legumes, lentils, beans, and chickpeas. 6. Whole grains, brown rice, oats, and quinoa. And 7. Eggs, especially the yolk. Regulation of calcium and phosphorus metabolism. Hormonal control. Parathyroid hormone, PTH, increases calcium levels by stimulating osteoclastic bone resorption and renal calcium reabsorption. Decreases phosphate levels by promoting renal excretion. 1. 25-dihydroxycholecalciferol, vitamin D. Increases calcium and phosphate absorption in the intestine. Enhances bone resorption and mineralization. Calcitonin. Decreases calcium levels by inhibiting osteoclastic bone resorption. Metabolism of vitamin D. 1. Skin. 7-dehydrocholesterol vitamin D3, UV irradiation. 2. Liver. Vitamin D3 2,5-O-cholecalciferol. And 3. Kidney. 2,5-OH-cholecalciferol 1, 25-dihydroxycholecalciferol, active form. Hypercalcemia versus hypocalcemia. Hypercalcemia. Causes. Primary hyperparathyroidism, malignancies, hyperthyroidism, sarcoidosis, vitamin D, toxicity. Drugs. Thiazides, calcium supplements. Manifestations. Bones, stones, groans, and moans. ECG. Short QT interval. Treatment. Hydration, loop diuretics, bisphosphonates, calcitonin, dialysis, severe cases. Hypocalcemia. Causes: hypoparathyroidism, vitamin D deficiency, renal failure. Manifestations: tetany, Trousseau's and Chvostek's signs, convulsions, prolonged QT interval. Treatment: calcium gluconate, active vitamin D supplementation. Pathological conditions: primary hyperparathyroidism. Pathophysiology: parathyroid adenoma PTH, increased osteoclastic activity, bone resorption, hypercalcemia. Manifestations: osteitis fibrosa cystica, brown tumors, subperiosteal bone resorption. Investigations: elevated PTH, serum calcium, decreased phosphate. Imaging: salt and pepper skull, subperiosteal erosions. Treatment: surgical removal of adenoma. Secondary hyperparathyroidism. Causes: chronic renal failure, vitamin D deficiency. Findings: hypocalcemia, hyperphosphatemia. Tertiary hyperparathyroidism. Etiology: prolonged secondary hyperparathyroidism leading to autonomous PTH secretion. Diagnostic and management tools. Diagnostic tests: serum calcium, phosphate, PTH, and vitamin D levels. Imaging: ultrasound, subtraction scan, MRI, ECG, QT interval assessment. Management strategies: address underlying causes, hormonal therapy, vitamin D, calcitonin. Surgical interventions for adenoma or ectopic PTH production. Complications: hypercalcemia, peptic ulcers, acute pancreatitis, CNS dysfunction, osteoporosis. Hypocalcemia, neurological, seizures, paresthesia, cardiac, prolonged QT interval, dental abnormalities.